Hi, I'm Sister Simone Campbell. I'm the Executive Director of Network, Lobby for Catholic Social Justice, and leader of Nuns on the Bus. And here we are today in southwestern Virginia, way down in the corner of Virginia, and we're going to visit with the two doctors from the Health Wagon. So let's bring out our guests.
Oh, thank you for having us, Sister Simone.
Oh, welcome. So glad you're with us. So, Dr. Teresa Tyson and Dr. Paula Hill Collins are the, uh, I don't know, you're the drivers as well as the medical staff.
Teresa is.
I drive. Paula will not drive because she's afraid she'll run over somebody.
So. Yes, I really am. I said I'm trying to heal people, not hurt them.
I get that. But you're in Southwest Virginia. Could you tell our viewers a little bit about where you are and what your part of the world is like?
We are in the corner of Virginia. It's the southwestern portion of Virginia. We are in that area that's close to Kentucky, Tennessee, West Virginia. We're in that area here. So we are in Virginia. We're in the central Appalachian mountains right here. So there's been a lot of chronic poverty, a lot of need in the region that we call home. And we have the Health Wagon, which is a free mobile clinic that goes around in the region and provides primary and preventive care. We also have 2 stationary clinics in the region as well. We're the medical home to over probably 4,500 patients. Wow. And last year alone, we had over 19,000 patient encounters giving free medical care because we have a very underserved and isolated population because of the mountain. So what we do is so important. We were actually founded by a Catholic nun, Sister Bernie Kinney, and she came here at the request of the Richmond Diocese because of the poverty in the area and so much need for health care. So the Health Wagon is the oldest free clinic in the nation, and it was started by Sister Bernie Kinney, a Massachusetts Catholic nun, all those years ago.
And we actually say that we are so isolated from Virginia. Our residents down here, Teresa and I grew up here. We've been best friends since we were 14 in 8th grade. But I compare it to the Great Wall of China. It's like at Roanoke, Virginia stops. And our legislators down this way fight hard for us, but we've got little voice. Teresa and I have loud voices. We have a lot of passion. So we are fighting for our vulnerable and for the underserved. That's what we do is we fight and we get things done and changed because that's what we don't back down from anyone or anything when we see someone hurting and we see the vulnerable and we see people dying because they don't have health insurance. We're strong advocates, and I think we are fortunate that Virginia expanded Medicaid, and I feel like it's a part of the reason it was our advocacy because we had every legislator from going back to several presidential elections ago come and visit and tour the big summer event that we have here in which we serve thousands of people in 3 days.
Wow. Well, okay, so you're in the southwest corner. So it's really mountainous, windy roads, no superhighways.
No superhighways. The interstate, the closest mall is an hour and a half. The closest airport, not major airport, but the closest airport that actually has the major airlines is an hour and a half away. So we're isolated. I mean, our people are isolated, and that's the reason our culture is the way that it is too. We've been a culture of extraction. We're a coal mining community, and people have come and taken a lot out of this region of Virginia. But we feel like we've been kind of neglected because we need to be part of Virginia. We need to get part of the funding down here to our patients and to take care of our patients.
Paula has long wanted to succeed from Virginia because of all of this, because of isolation. But it really is it's really no laughing matter though when we look at it because there's so much healthcare disparities here. We have such higher rates of diabetes and heart disease and cancer and breathing issues. COPD, and we often say that's the reason that we're the Bible Belt because we're praying about all these diseases that the people here, our people here, they live 20 years less than a counterparts out on the eastern shore of Virginia, if you can believe that. There's like
20 years
trauma here.
chronic trauma here, a lot of adverse
Yes.
childhood events that happen to children,
So
and that's
sad.
growing with the opioid epidemic, where children already before they're born, they have an adverse, there's ACE scoring is what it is. They're already so high, and as they get older and they're exposed to more trauma, more abandonment, more loss, those ACE scores go up. So what Teresa and I and people here at the Health Wagon are looking at doing is building resilience. We want to develop programs to where those children, yes, they may have that adverse childhood events, but we want to build that resilience in them by letting them know they have somewhere to come to, and they have Teresa and I, who we will not back down. We actually, we can ask every governor we've had for the last 10 years, and they will know, yes, they will chase you down and follow you, and they'll talk as fast as they can to get their word in.
Yeah, it's that lifespan. Anybody should not have a shortened lifespan in the United States of America because of your zip code, and we're strong advocates for that. And I think God has given us a voice for our people that often have not had a voice here in the mountains. So what we do is so important.
Well, I'm curious because you were saying that it's been coal that has that was the big extractive industry. What's the industry now? How is this economy working?
Yeah, I mean, we really have nothing left. I mean, it is the prettiest part in the world. We truly believe that. But the school system is the #1 employer now. I mean, coal has been like decimated, and we don't see it really returning. I mean, there's very few coal mining jobs left.
Our area is economically devastated right now, and we need everybody across the country to pray, because we do not have the infrastructure for even the trains used to be used a lot. A lot of the train tracks have been torn up. We just have a lot of things that are against us, and we feel like there's a spirit of poverty. But as far as financially, we have been financially devastated. A lot of our young people are leaving. There are very few jobs here to get, and once you're laid off from the coal mines, you're talking about people that made very, very good money. It's hard for them to go work at McDonald's. It's hard for them to go work at even a call center, because they go under the ground. They risk their life every day, and as they risk their life, they are put into a high disability rate. I say that we make old men out of young men early because of the conditions that they're working at in the coal mine, under the ground in the coal mines. Teresa is a coal miner's daughter. I'm a granddaughter of a coal miner.
Yeah, and my dad. I mean, the people here are the most wonderful people in the world. They are hard working. They're God fearing. They're church going. Beautiful, beautiful culture of people that have been disproportionately affected by poverty. We're often, with Paul and I said that there's a forgotten population. But my dad, there could not be a harder worker than my dad. I mean, he actually ruptured a disc in the mines, but he went on to work anyway. And what he would do is he would tie a belt around his leg, because you get the sciatica that goes down the leg. And because he had 4 mouths to feed, it was an option not to go to work. He would tie a belt around his leg and go underground in the mines and drag himself from, because it's, low coal. I mean, sometimes it's 2 feet coal, to provide for his family. And he is so representative of a lot of the men and women who've been in the coal mines. They're God-fearing, hard-working people. There's such negative stereotypes that Paul and I hate to see, that have been upon the people here that are just totally incorrect. I mean, these are wonderful, wonderful people here.
And we encourage education. My mother was a teacher, and it wasn't an option not to go to school. And one time we were very insulted because someone actually, a reporter said to me, well, if you all did have the schools down there, people wouldn't go anyway. And I'm like, yes, they would. Yeah. Yes, they would. That was actually because, and my mom went to school. My dad had his master's degree, and my dad was born in 1927. Yes, people do go to school here if they have the opportunity. We have the University of Virginia at Wise here, and that's something Teresa and I are advocating for more programs here. If we could bring, we could make it a college town, build it up more than just a liberal, 4 years liberal arts university, to where we can actually bring in more graduate programs, because we don't have a lot here. Our coal mines have been, the underground coal mines, the owners made a lot of money, and most of them left. I have to say, we have one that was so generous to us that he helped us build this building. Most of them left and forgot where they came from, and they took the money. The workers that were working, they decided, well, we're paying these underground coal miners a lot. Let's just go cut the mountains off. So it's called fraction in the mountains. So our mountains were actually cut off, and it's called strip mining, to take the mining off. And Teresa and I aren't political because we've been in this long enough that I can tell you right now, I'm not political. I'm not liking anybody. Okay, I like people that are for the people, and that doesn't matter what party you're for. And I will always say that. Now I have to say, we have a favorite with Senator Warner, because he came down here as a governor. He saw this poverty. He went back and put us in the budget for $400,000. So other than Senator Warner, we are very non-political. With a thumbs up, and that's just because he did see the need of our people.
No, Paula, but what you're lifting up is what Pope Francis says in his new letter to the world, is that doing politics is all about being engaged in conversation and in encounter with real people. And that's what he said, when Senator Warner was governor, that's what he did. He met your people, knew their needs, and responded.
Now, he did, and that's what we want, and we've never forgotten that.
Yeah.
Because, he's very bipartisan too, and I feel like that is what this country needs. Teresa and I were privileged to get to sit in on with, which all publics can do. You can go in and watch a Senate meeting and watch, the Congress interact. And I'm going to tell you, I was very disgusted, and I was at everybody, because it was like a bunch of school kids. And I'm saying everyone in there, not Central Warren or any of us that we represent here, not Virginia, but as a whole, the behavior is childish. It should not be political when you're trying to save someone's life.
Healthcare should not be political. This COVID should not be political. This is it's crazy.
Yeah. Okay, well, let's shift and talk a bit about your healthcare. So describe your wagon. Describe this wagon to us when you travel around. So you've got 2 fixed sites, and then you have this mobile.
Yeah, because healthcare, transportation is lacking here. So Sister Bernie was very innovative. If one word describes the Health Wagon, it's innovative. And I think the people here of Appalachia, they have to be innovative to survive. So Paula got that innovation in our blood, and Sister Bernie, she came with innovation. So healthcare delivery in a mobile unit was highly innovative. There's people that come here and they want to replicate this in other areas, but it's taking people and meeting people where they're out in the community, taking that healthcare to people. We were also innovative in, we were doing the largest, until COVID happened, the largest medical outreach in the United States. It was a 3-day week. In addition to providing care 365 days a year, we were doing a massive event where we were giving free eye, dental, and medical care at a fairgrounds locally, and we would see 25 to 3,000 patients over a 3-day weekend. It would look like something you would see in a third world country, where people would come up and line up. I've seen them come and line up as much as a week in advance for health care. And we have seen we've seen over 100,000 patients over the 20 years until COVID. So, but we're gonna be back on for 2021. Always need help with that. We also did the first FAA drone delivery in the United States, delivering medication.
The what?
We did the first FAA drone delivery approved in the United States, with some wonderful partners, Flirty, NASA, Virginia Tech. There was just so many involved. Jack Kennedy here locally, RAM. So we had many wonderful partners, but we delivered medications via a drone and delivered medication. That was in 2015. Our drone is going to be put into the Smithsonian there in Washington, D.C., where you're at. We did the first ever wound care clinic in the nation over telehealth. We have so much telehealth. We've got a wonderful partner, University of Virginia.
Radford University.
Paula and I, we actually do telecystoscopies, which is the first time in the world that this is being done over telehealth. That's where we're putting a light in the bladder, looking for bladder cancers. We have so many firsts here at the Health Wagon. That's what we're all about, is that innovation.
And yes. And to tell you just a little bit about our van, it is actually a mobile clinic on wheels. But our hero, Sister Bernie, started in the back of a Volkswagen Beetle. That's why we got the name, the Health Wagon. Up and down the mountains in that Volkswagen Beetle. Now, in 2006, She passed her reign, and I say her mantle, just like Elijah passed his to Elijah, on to Teresa. And Teresa has taken us into the 21st century. And
I've been here for 27 years.
Yeah, we've
I've been here all my
expanded.
life.
She has expanded. Since she took over, we now have 3 mobile vans. We have a dental van with a dentist, thank goodness, thanks to a donor that saw us and knew that we needed a dentist. We have a vision clinic with University of Pikeville that is starting at our new clinic in Clintwood, and we still have telehealth. And again, I think with Dr. Tyson's leadership, as soon as COVID started, we love our staff. We love our people here. We shut the clinics down. We went right to telehealth, and we had it already in place. So when other people were still struggling in our area, and I think across the nation, from March 13th, from that last clinic that we had, that we thought we better shut this big health fair down because COVID's here now. We had one day, shut it down. Dr. Tyson and I met with our staff. She immediately implemented telehealth.
Okay, but we've experienced in mountains where we've been visiting different parts of Appalachia on the Kentucky side, Ohio side, that there's trouble with internet access. So doing your telehealth, is that difficult for you? I mean, are you able to get connectivity?
It is at times. It is at times. And we do have we actually have tablets for each clinic, because we have the 3 clinics. If it is one staff member is exposed to COVID, the whole clinic is out. So we divide it up into teams, but we do have a tablet for people who do not have good internet access. If they can get to the clinic, they are given the tablet to use outside of the clinic, and we see them from inside.
And we
to limit their exposure to anybody, because we don't want, our patients are vulnerable, and that's what we fight for, is the vulnerable. And that's what I said, the vulnerable, those underserved, those children that do not have a voice. That's the passion that Teresa and I have. That's who we fight for, and that's why I said we won't back down until we see changes.
And that was one of the good things. I mean, using common sense. I mean, with Trump, I mean, he allowed us to see patients like, over the phone, over, the connections and stuff, over Facebook, over, things like that. So that really allowed us to see patients in a non-traditional approach that has worked very effectively. I actually took care of a patient up in like Ohio that had COVID and had no access to care. So that has really opened a lot of the doors for us as well, actually. And we've got a wonderful medical director, Dr. Smith. He actually helped us to take care of him because of the laws, about treating patients in different states and things like that. So, when they gave us some of that common sense, things that we could change things and see patients in a different approach, lifting some of those barriers, because that's all what the Health Wagon is about, is lifting barriers. When they helped us to see a lot of patients in different formats, so that has been absolutely wonderful. Now we've continued the clinic on too. We still see patients in the clinic, but we see them a lot. We see them out in the cars and things like that. But some patients that are very sick, we have to go ahead and bring them in to the clinic as well. So we've used a lot of different approaches in this to meet our patients' needs,
including sending one staff member and maybe a support member into our elderly patients' houses that can't get there.
A lot more home visits.
Yeah, a lot more home visits. And what we do is Teresa or myself go in, or some of our nurses will go in. One of them will go in. We go in fully protected, with our PPE, and then we take them out to work at home for 5 days.
Oh, wow.
Until we can get their testing back to make sure that everything's okay. And Teresa and I probably tested ourselves for COVID 6 times.
I know.
Because I don't want to hurt anybody. I don't want to bring this home to my family, to my children, to my grandchildren. I don't want to do that.
Amen. Okay, but what I'm hearing is a lot about staff. So tell us, and your staff is your family, and you're taking care of them, and it's really good. But talk to me about, who all do you have on? I mean, okay, because my first image was, okay, we have the web.
Yes, we have such a limited.
It's a whole train by the time we're through. So talk to us.
We do. But tell her how many full time we have.
We've got.
We're proud of what we do.
We've got a total of 29, but most of those are like part time and things like that. And we use a lot of volunteers and things like that as well. So we have a big geographic footprint, but we've got very little staff. What have we got like full time? About,
I think 15 full time.
I don't know. Yeah,
we have.
11
full
that's
time.
like 11.
Yeah, we
11.
have,
Okay,
we
you
have
got
our
your
great
helpers.
writer here with us, and she's just phenomenal. And she's doing this for 11.
Yeah.
We only have 11 full-time staff members, and we saw 19,000 patients through the use of volunteers, part-time staff. We did more, and this was actually from previous Governor Kane, said we did more with our $400,000 budget that they gave us at that time in Virginia than most people did with $1 million budget.
With 400 million.
400 million, yeah.
Wow.
We don't have a lot of staff, but we get a lot, we get a lot done. And
We
so we're
have very
always looking
good
for
staff.
volunteers, but they're like us. We kind of screen them for that. We want them to have that caring, compassionate heart. And God has blessed us phenomenally with such wonderful staff, because we could not do it without them. I mean, there's people, they will go, you could call them up we got staff, you could call them up at 3:00 in the morning, and they would go check on a patient for us.
And that's
they're awesome.
And when we are interviewing, we actually tell them we are faith-based. We were founded by a Catholic nun. We want people to see the hands of God in us as we reach out. They want us to be able to see the face of God when they look at us. And we're not preaching to anybody, but we're just saying, if you cannot care for those that are least among you, is the Bible verse. Look after those least among you. And that's what we have. The children that have no voice, the people that are uninsured, those are the least among us. Those are the vulnerable that are hurting. And that's who Teresa and I have fought all these years, and Sister Bernie did, to take care of. And we still want to do that. And when we interview anyone for a job, we say, now we're faith-based, and we want you to know this, because this isn't just a job, it's a passion.
It's a calling.
It's a calling.
I really feel that we were called, because we always said that two are better than one, and we really feel that God put us together during this time so that we could care for our community here in the way that we do. And we have learned so much from Sister Bernie and our Catholic brothers and sisters in Christ about social justice and about social outreach, and
and taking care of your fellow
Yes.
man. And we have learned too, but two are better than one. And that's when we're out there talking to the legislators. We've got two of us together. Two are better than one. And a cord of three with Jesus Christ in the middle of it is not easily broken.
Yes.
I love it. I love it. That's great. That's great. Well, I hear this sense of calling and this sense of commitment. And I'm curious, because you were saying that so many young people can leave because of opportunity, because of lack of choice. How did you two decide to stay? I mean, what was your...
We really feel that it was a calling of God. I mean, I know for myself personally, my grandmother, she actually cared for people with TB when there was not a cure for TB. She wasn't a nurse. She always wanted to be on the mission field. And my mother, she wanted to be on the mission field taking care of others. And I think that God put us together so that we could be on our own mission field here, because people are dying daily without healthcare access. And so I know that when I very first came here, like 27 years ago, I mean, I know that it was divine inspiration. And then, Paula joined me, several years later. I know it was the hand of God that he had upon Paula and I to start our friendship at 14th. And we graduated high school. We did our bachelor's together, our master and our doctorate. And I told Paula, I don't want to go back to school no more. We're done with that. We spent all our life in school. But, God put us together at this time for this purpose and for our people here.
For such a time as this is what was in the Bible. But what I want to tell you, with Teresa and myself, in all honesty, who else would do this? Not many people are going to give up opportunities other places that have a lot of more technology. There's not a lot. Who's going to do this? Sister Bernie, God led us into this calling and a mission, and we do it because we love what we do. I honestly love every one of my patients, and it makes it all worthwhile when I see my patient that no matter what's going on in my life, because we all know each other, they will send me something. They'll send me a word saying, Paula, we love you, and know we're praying for you. So it means so much to me, and that's just
you're making our viewers jealous, because they have that same quality of medical care or relationship with their primary care physician. So I'm just saying, you've got something that's special. That is fabulous.
And we're huggers here. I mean, we hug our patients, and I said, what we were talking about a few minutes ago, I said, what COVID has done is that March 13th, that was the last time I got to hug one of my patients, and we took so much for granted, and just, maybe in the future we can get back to a better time, because, that touch is healing. And Sister Bernie, she always, she talked so much about, the touch and the healing and the social justice and things like that. And so maybe, hopefully 2021 will bring us back to where we can hug our patients again. We miss that, Paul and I do.
And we'll have solutions. And I really wish you could see Sister Bernie. She is like you, Sister Simone. She's not your regular nun. She doesn't wear her habit. She has flaming red hair, is how she was described by one of our senators here.
I have to show this.
Yes, that's where I was getting there.
Oh, I love it.
During the coal mining strike.
Yes.
This is a picture of her coming out of the federal courthouse, because she had our first donated bus. And there it was during the coal mining, and you just have to know Sister Bernie, it just really bothered her that she was arrested, because she had her license, she was a nurse practitioner. But I said, can you imagine the outcry, because people were fighting for health care benefits. She was going up big Hurley Mountain in a big old Winnebago, and there was a coal truck behind her, and he went and testified for her. Some young state trooper, must have been right out of school, and thinking he was doing the right thing, decided to arrest a Catholic nun in a mobile health van delivering free health care. We made the Washington Post, the New York Times. I mean, I think he probably got transferred somewhere, because I'm sure she forgave him, but I don't know what he was thinking. But the good thing is, you can bet that coal mining strike ended and they got their health care benefits.
Amen.
Was hailed as a hero after that. She came out a hero to the people, because she was a voice to them, and she was wanting that healthcare access. And and probably Sister Bernie, she may have been impeding traffic, we don't know, because she was all for the people, and that's the reason that people loved her. And Paul and I just want to carry on a little bit of her fireness.
And she was the one that taught us to not back down. You just keep going,
Amen.
keep going, you keep talking, you keep asking. And she said, you're never asking too much, and it's not about us. It's
Wow.
about it is
and the Holy Spirit works with what looks like a problem to make it.
He does.
Amen.
We see it all the time. We see miracles here. I promise you, we will need a medicine, and we'll pray about it'll come in. I mean, like Sister Bertie, I know she's talked about that. I mean, I have actually seen, us need a medicine and really not think that it's in there, and go and look in there and it's there. I mean, God provides. He has always provided. And, the funding for any nonprofit, that is the most critical thing for us. And, God just keeps providing, because I said, if God called us to do it, then God will pay the bill. So I don't, we work very hard, and Rachel Helton here, our grant writer, she works extremely hard, and we all do, taking care of the patients and trying to raise money. That's always been the hardest part of it, but we've always got that faith in God. He called us to do this, and he will pay the bill.
And it doesn't matter if someone gives us $1 or if they give us thousands of dollars. We are so grateful, because that saves a patient's life.
Every day,
patients' lives are saved, and it gives us the ability to go out and keep seeing patients and to do innovative things, and like the partnerships that God has sent into our life. And you have to have this calling. And us being raised similar, my mom used to say that in order to be blessed, you must be a blessing to others. When I was little, my grandmother, she worked as a nurse's aide, and she would knit me nursing caps. So I was a baby, so she would knit me the nursing caps. But Teresa and I was taught at an early age that it's all about God, and our purpose here is to serve him. And I can remember my grandmother saying, perhaps for such a time as this, she would pray that over me and pray blessings. And I say, every time that I think something's going, and like you said, you may see it as a negative, I always go back to that. There's a purpose for it, and for certain, this may be why God created me and why he created Teresa, to go forward with that purpose.
Amen.
God has his favor upon this organization. There's no doubt about it. He has his favor and his hand upon this organization, or it would not be here. Because actually we were with the Catholic hospital all those years ago, and they went through financial troubles, and it was sold to a nonprofit. And when the for-profit wanted to end us, but God seen otherwise. And Sister Bernie had squared away some money for us to go independent, and we didn't know if we would make it or not, but God has seen otherwise, and we're still here after all these years,
great.
40 some years.
And
Well,
we just built a new clinic in Clintwood, and that's where we were founded, is in Dickson County. That's where my dad was from. That's where Teresa started out. And Dickson County is one of the poorest counties. And the name of that clinic is Sister Bernadette Kinney Clinic of the Medical Missions of Mary.
Yeah, beautiful. So we do that in honor of Sister Bernie, you know, for her legacy that she has devoted her life here in the mountains, and pay tribute to that, because that's very important to us, because she's our mentor, and we just love her so much. And the MMM group that started that here all those years ago.
They're a fabulous group.
They are.
Can we talk a little bit, because what you just said about that, originally connected to Catholic Health Association, and then it went for profit, and the finances changed. We know that healthcare in the United States has changed dramatically because of the financial model. And what you're doing, that hands-on engagement with patients and service of patients, is so critical. I'm curious, do you have relationships with hospitals now?
Oh gosh, yes. Well, we do have relationships. I think God has given us that gift of like networking, because we could not do in isolation. You know, we have probably over 200 different organizations that like help us. We have over 50 partnerships with, you know, colleges and universities to bring students in, to give them a sense of their clinicals and, you know, their education and so forth like that. So God has blessed us phenomenally with lots of, you know, networking partners and things like that. We're always looking for additional partnerships as well, you know, as always. But with the, you know, we can have a need, and I promise you, we can say we have a need, and so the phone will ring with an answer to that. That's how much God is here in this clinic. It's just totally amazing. We're blown away really much on a daily basis of how God is His favor here.
I want to show you all another picture of Bishop DiLorenzo. He came down from Richmond, and we brought him to tears. He blessed our new mobile unit, and actually up until his passing, and, you know, and I know there was a lot of funding. He funded the clinic. You know, that has been had to be cut out too, because everyone is suffering across. But he actually was brought to tears when he saw our 3-day clinic. But he blessed our hands. There is myself, Sister Bernie, Teresa, and Bishop DiLorenzo. You can see Sister Bernie.
I love it. Yeah.
Right there.
Yeah.
That's fantastic.
Yeah, and that's why we said God brings people into our lives, because Sister Bernie had a very close relationship with Bishop Sullivan, and we didn't really know.
Yeah.
And then, you know, when he turned it over to Bishop DiLorenzo, he saw the need, and he, you know, had some health problems. I think he didn't like traveling down here a lot, because it's so far. We're closer to 5 other state capitals than we are Richmond. So we really, I say all the time, we should have just went and formed our own state during the Civil War. It's because we made it.
That'll be what we work on.
That's what we'll lobby on next, is getting our own state. But we were forgotten. But for us, we had told him so much. We had traveled up there. He came down here, and that meant so much to us. We were so thrilled to have him down here.
Yeah. I can imagine. Okay, so you've talked a little bit about COVID. You've talked about your staff. Could you describe for us kind of a profile of your patients, what your patients are like, what their lives are like? What does it mean to live in your area?
They're like I said, they're the most wonderful people that we have. I mean, there is a lot of chronic poverty in here, but they are beautiful, hardworking, God-fearing patients. Typically, it's women. A lot of the women, you know, we see probably a disproportionate share of like more women than we do men, and they're older, like 40s and 50s and 60s. They just don't have access to you know, the health care
because they stayed at home while the husband went to work in the coal mines. So when he became disabled, and we're talking about, we have people in their early 50s, and I think even late 40s, needing lung transplants because of pneumoconiosis. Yeah. So when they become disabled, the female who stayed at home and worked taking care of the children, which was traditional. She was left without health care insurance.
And a lot of women have not, not just stayed at home. They don't have jobs, that provides them with like health insurance and so forth. Like they're working at restaurants, they're cleaning houses and stuff like that. Very hard, very hard working.
Physical work. Yeah.
Very labor intensive.
A lot of service industry here.
We have actually the highest disability rates. We have like 6 out of the top 10 highest disability rates in the nation here in our surrounding counties, because of the labor-intensive mining industry, and the work here has been labor-intensive.
You're talking about going to work in 6 inches, 12 inches of underground coal, and that's why the story of Teresa's daddy, because we grew up together, and I know her dad, what a hard work he was. And when she was telling me about him wrapping his legs, that's what we're seeing. This is not people can say, oh, well, they could work if they wanted to. Really, if you've not been here and you've not done that, let's not cast judgment, because we see people every day that if they could work, they would be out there working. And the high disability rate is because of the coal mining. It was the coal mining industry, but now that it's gone, as I said before, we're economically devastated. We're praying every day, and we're hoping God will help Teresa and I to help bring in something into here. We need a major road system. Yeah, and that's going to be something that has to happen.
And changes. Just like one of the laws. Or I don't know how you would even go about changing this, but I know that we've got like even disability judges like over in Eastern Kentucky, and it's the same. It's basically the same population here with the disability judges approving Social Security, a 6% rate. There's a judge that sits there. In one of the most disadvantaged areas in the region, which is Eastern Kentucky, and you've got these judges that will not approve like people's disability, and they severely need it, because Paul and I write disability letters all the time, and we have such a hard time getting people's disability sometime. I don't know what the process is at, and I don't know how to fix it, but I thought that's something I would love to work on too. Because I know that it is certainly a need. There's lots of needs.
Which my husband's an attorney, and one thing he was telling me, we were talking about legislative changes, and he said one thing you all need to add, he said, is the court systems are going more about presumptive. They're making presumptions with the law. And he said, when you need to do that, he said, you look at the law that you're looking for, and he said, you see what presumption needs to be changed. We make presumptions. And he said that is a good way to approach. And it's true. When you're looking at, it doesn't make any sense to me to let someone die and become disabled in their 40s or their 30s because they lacked the health insurance. We had a patient that died at 35. The only time he ever received health care for his diabetes was when he was in jail. So when he was 32 or 33, he came to us blind, in severe renal failure, and he ended up having a stroke. And he actually came, and when we were on 60 Minutes in 2014, he came and spoke, and he said he wouldn't have been alive then, and if it hadn't been for us. We were the only health care he ever had. And we just think presumptively, as my husband says, presumptively right is right. And when you're looking at this presumptively, how can you let people get disabled and then have them have to go on disability when having health insurance is preventive? It would have prevented him. If all he would have needed was insulin to control his diabetes, and it would have saved him from having a stroke, it would have kept him from being blind, and it would have saved his kidneys.
It's a shame, but between life and like somebody diabetic, there is some cash, to buy that insulin. We see that every day here. So, we try to look at a lot of different things. We try to be an advocate for a lot of different things that mean a lot to the people here, like in the region. So we take on a lot of other issues, outside the healthcare arena, what we feel, is important. One of the things that we're working on is, expanding like grandparents' rights, to see children like in the in the state of Virginia too. That's one of the things that we're very passionate about too. So we're always looking, out that stuff that affects our, our community and our region.
And affects our children whenever that children are ripped apart from part of their family for whatever reason.
Amen.
That's what we actually, presumptively you can see anyone is taken away from family important to them. I worry about Teresa's
stability.
Yeah, and we've had a lot of children, grandparents now, things are changing. My grandmother was very supportive of me. I would run to her house all the time. But right now we're living in a time to where grandparents are raising their children. Great grandparents are raising their children. They are so important. And like we have Teresa's sister who's actually raising her granddaughter.
Mhm.
If her, yeah,
Raise her.
and
Okay, wait. So,
Mm-hmm.
because I was going to say earlier, social determinants of health is what the highfalutin sounding thing that we call it. It's everything around you affects your health. So
Yeah.
nothing separate. But the piece that I'm wondering about this now is the issue of grandparents raising grandkids. Is this related to the opioid crisis or to other
Yes,
disabilities?
a lot of it is related to the opioid crisis. We actually have great grandparents that are raising grandchildren, and in the case of Teresa's sister, if the mother or the father ever came back and said, even though she's had Isabella since day one, they could actually take Isabella, possibly. Now, my husband says, possibly, because we need stronger laws.
Yeah, your husband's a good lawyer. I can tell this. Maybe, possibly, perhaps. Yes.
Possibly, perhaps. That's what he said. Presumptively, he said these are words you need.
And the school system here, 70%, where my kids that traditionally went to school at Coburn, they say 70% there in the little primary school are being raised by their grandparents or great grandparents. So we try to build stability, not just healthcare. We try to build any resources that we can to help that family be stronger and thrive and build resilience in that family, because I think that's where we've got to get back to. I mean, there's so much chronic disease in the region. We've got to get back to these children and build resilience in them and build as much support around the children as we can.
And to go against those ACE scores that are so high,
yes,
that give someone like a mentor, like a grandparent, that will bring resilience, someone that they can rely on, that's stable. And that's at our heart too. And we actually we've had multiple attorneys across the country that's working with us with that right now too.
And the ACE scores, that's what it's adverse childhood experiences. So like if you score like a certain score, I think it's like over a 4 or more, and it's things like, if you've experienced physical abuse, sexual abuse, even divorce is one of these. If you've got a person with a mental health issue, the more you score, it actually shortens your lifespan by 10 years. And I think that is what we're seeing in the region.
Causing harm,
all kinds
even
of trauma,
as an adult.
They have experienced. They've experienced trauma after trauma, living in where there's chronic poverty, because chronic poverty brings all these other things in, unnecessarily. So we're going back and building resilience in us. We've got to get to the children here in the region to make a difference, to turn around those long-term chronic disease indicators, to turn around lengthening that lifespan rather than shorten it. So that's what we're all about, is building resilience in our community and in our children, and continue to help those with chronic disease, but we've got to get to our children.
And the sad thing about this is when the grandparents sometimes are given custody of a child, they actually do not have health insurance, because their child, they don't really have custody. They're raising the grandchild, so they're not able to get Medicaid. They're not able to get any assistance, especially if it's a retired coal miner. And I've had that. They bring their children to see us because they're not eligible. And like I said, I love my grandmother, and she's the one who made me nurses' hats. And I mean, I just think of she was full of fire too, and her spirit is what still. I said I'm my grandmother's daughter. She taught us to give, and I'm just so thankful that I had her and had my mom, and that taught us the social justices that, as growing up Southern Baptist here, we were limited with missions. That's one thing I so admire about Catholic, and Teresa and I actually say we're closet Catholics. I mean, will say that because we actually, so much of our heart is with social justice and taking care of your neighbor.
And empowering women. Now that's important too, because Paula and I both had very strong mothers. My mother's Pauline, and Paula's mother, Maddie Ella. And Paula's mother, she had blonde hair, and my mom looks exactly like Paula. And everybody always got us confused, but we had very strong mothers and grandmothers. Yeah, and so we're all about empowering women, as Sister Bernie was too.
Yes, and we spoke across the country. So Teresa and I were so close to our moms. They traveled with us a lot, and everybody would say, "So is this your mom?" And I'm like, "No, that's my mom. I know she's blonde and fair, but that's my mom." And yeah, you see Pauline over there. Yeah, no, she's got black hair like me, but she's Teresa's mom.
Oh,
And
so
they
I
love
love
us,
it.
they help
I
us, and they
love
love
it.
to follow us. And my mom worshipped, and Teresa's does. Teresa's mom actually raised one of her grandchildren, and my mom loved my son and my daughter, and that's why we're going after to make sure that the children, the grandchildren, have that protection.
Yes.
Absolutely. Absolutely. It's so critical for the future. And so much depends upon how the adults can act. And so taking care of the kids, making sure the adults can participate in their lives in a constructive way, that's what I hear that you're doing.
Yes.
Can we just talk a little bit more about this opioid crisis, though, because we've heard from a couple of places that it's the hopelessness and the lack of opportunity is creating a bunch of that, the use of opioids or the business of opioids.
We're actually working on that with the MAT clinic.
We do have a medication assisted clinic that we didn't really have time to do it, but God called us to do it. And so that is where we help them with medication to get them off of, off of different, things that they might be addicted to. But we wrap that with some, spiritual. We try to get them counseling that they need. We have wonderful psychiatrist, Dr. Carey, and we have UVA, wonderful partnership with them, and they have addiction specialists there, the counselors from Radford University. And so we've all come together collectively to take care of a group of people, because people do not choose to be like addicts. I'm not saying people don't make a wrong choice, but I make a wrong choice when I ate a cheeseburger yesterday. You make wrong choices.
Let's not talk about those wrong choices. We won't talk about those. Okay.
Dr. Smitty actually sung a song one time that brought absolute tears to my eyes, and it was somebody pushed me on the swing, and it was about a little girl, and all she was wanting was somebody just take her hand and push her on the swing. And that's how we see people, and that's how we see these adults that have made poor choices. At 5 years old, they didn't grow up and say, hey, I want to get addicted to opioids. That's not what they.
And we have to be so careful. We don't refer to them as addicts or druggies, or even in the testing here. If we have to test somebody's urine, a clean urine, dirty urine, well,
we don't use those words.
We don't use any of that terminology. These are people that God cares about, and they have, and it's really hard to judge. It's really easy to judge these people, but they have had hard times, hard lives. And they have made, sometimes the wrong choice. But, as God calls us to lift them up. And like I said, we didn't have the time or the energy or the inclination to do medications, but God gave it to us, and He has provided
and He's
for that.
Seeing that it's working.
And it's working. It's wonderful. Kara Robinson here, nurse practitioner, did an excellent job, bringing that about.
And
so
we really actually brought in the Commonwealth Attorney in when we were doing this, because we wanted to know, what are you all seeing? And I wanted to get this out there to everybody. We actually are not prescribing just another pill to substitute. We're giving an injectable medication called Sublocade. It was very hard to get approved. This helps prevent diversion, and it also helps to make them accountable. So they come into the clinic to get an injection, and they receive their injection there at the clinic, because we want to help them. We don't want to contribute to their problem. And like I said, we didn't think we would have time to this. And Teresa says, God provides. God always provides. Yeah. And like she said, Kara Robinson is our nurse practitioner that's over that clinic, and she has made it thrive. She has actually chased down Upsman to get it, because we have a hard time getting it delivered. So she chased down Upsman to say, hey, you need to bring this medication here. You're going the wrong place. Yes.
Yeah.
I love it. I mean, that's what shines out for you all, is that determination to respond to your clients' needs.
Yeah, we have to respond. God calls us, and we, He tells us to do it, but then He provides it. I'm thinking, oh God, why not?
Don't give me anything more.
Let me get caught up for the last thing that You promised to do.
But we pray about it too, and just God's like with awesome. You can, when God's Holy Spirit moves, if He's in it. Know if He's in it, and we actually pray that hearts of stone that do not see the suffering, that they are turned to flesh and love, because it's all about love. And God forgave us, and we're trying to show mercy and forgiveness to everyone. And we want to help them, and we want to help our patients. And it's the Holy Spirit. We could not do it without Holy Spirit's direction. And we know if something fits or if it doesn't.
Well,
Yeah.
I mean, like I'll tell you one example that we had like a year ago. I mean, Dr. Smitty, he says that he feels that we're called to like help out more to the college students and make sure that they've got access to, dental and eye care and healthcare needs and things like that. And, and he says that, one morning, and then the phone rings by the evening and says, hey, we're from a university. We're all wanting about, like student health. I was like, the phone is not running like that. I've been here for 27 years. Nobody has like called till today. And Dr. Smitty mentioned it like this morning or yesterday or something like that. And it's God when that happens.
Yeah.
When he brings the resources, you just know that it's God. It's ordained by God to do that. And we see that happen time and time again with any program that we've ever implemented. God is there to provide.
Because we're true and we're passionate about what we have. We spoke in Richmond at one event. It was a community collection of faith-based people, including Jewish people, Catholic people, Baptist, everyone. And we were able to recruit 3 wonderful Jewish doctors who Dr. Ike Kazil is a urologist, Dr. Gardner is an endocrinologist, and Dr. Oshansky is actually a plastic surgeon that comes down and helps us with lesions and dermatology. So they come quarterly before COVID. I mean, they're going to get back in it because they are retired. And we were just, thank you, Jesus. How did we ever think we would get to the point that we would have a urologist here, we'd have a dermatologist, and we'd have a endocrinologist who comes to see our patients. Dr. Aloy is from Wake Forest University. I could name them forever.
Dr. Ross Isaacs, he's actually a nephrologist, and his mother actually does counseling for us too. So and it's interfaith. I mean, and you see all this interfaith mixture. I mean, Paul and I, we're Baptists, and then, like all our help that comes from our Catholic roots and so forth like that, and our Jewish friends, and just everybody working together. We're interfaith here.
And Dr. Isaacs and his mother are Jewish, and Dr. Diane Isaacs is his mother. She has her PhD in counseling, and she said, I will see people. She lives in California. She's elderly, but she said, I will see people over telehealth for you that need counseling. So it's having the heart, and it's where people look and they know we're genuine. Our patients need us. These children living here need us.
Yeah, that's evident. That's evident. Oh my glory. Well, I'm curious. Okay, are there other healthcare professionals in the region, and how far would you have to go to get somebody to the hospital?
Well, we do have like a hospital here in our immediate area, but see, our patients doesn't have insurance, so that doesn't help a lot. I mean, we actually see people dying because they will not go to the emergency room because they know that they cannot afford that $3,000 to $4,000 bill. They die all the time, and we try.
So they don't qualify for Medicaid even with the expansion.
Well, we're probably we are probably got the best employee in the state who has the most numbers for enrolling those in Medicaid. In the Medicaid expansion did help our population quite a bit.
It didn't solve it.
But a lot of them we're able to get them, on the Medicaid. So that has helped some. That has been a very positive thing. It's probably one of the only positive things I have seen, on the political side is the expansion of Medicaid.
But we're saying, look at the bands like ours. Look at what Sister Bernie did. And she was actually in Africa.
Yeah.
She was in Africa and was brought here to southwestern Virginia. The poverty was so bad. And that was back in the 70s. And it's worse now because we grew up here and we can say that.
Yeah.
And we say, why not have free care for people using nurse practitioners and mobile vans across the country? Why do we have to make it so political?
It's not as hard.
Well, okay, but there's another piece of this. It's not just political. It's the business of healthcare. That's the one.
Yes. Oh, exactly.
Crazy. Because it's all about shifting more money to the top, and how much are the pharma chief executives making. So let's not blame it all on politics.
That's true. And we will tell you, we actually feel like car salesmen sometimes because we call around to get the cheapest MRI, the cheapest CT scan. How cheap will you do this for? And I say all the time, everyone may not need a 63 slice CT scan for $5,000 or $6,000. We actually have a program that's in Bluefield, Virginia, that will do an MRI for us for $1,000 and a CT for $500. So I said, even with pharmacies, we're calling around, how much is this medication? Because we want to help our patients, but it shouldn't be that way. Why is there such a discrepancy that an agency in Bluefield, it may not be the newest and greatest, but it's a CT scan, and with $500 sure beats, you know, $2,000-3,000.
And God provides us with insurance here, but it is cheaper for us to go over there and probably pay cash for it than our copay, you know, for that MRI or the CT.
Wow. Wow.
Yeah.
Okay, so we're going to have to come back and have another conversation about how we're going to wrangle the business of healthcare that's undermining the capacity to do exactly what you're doing. And we will also take on these politicians. Okay.
Oh, yes, ma'am.
All righty. Okay, we
want to take on.
Yeah.
Yes. I'd love to join that fight. It's my
yes, please do. And like we said, we want everybody to get voted, because my dad had a saying, if you don't vote, don't complain.
Amen. Well, we were just with this woman that had a sign in her office that said, let me get it right. Bad politicians are elected by good people who don't vote.
Whoa, that was good.
Politicians are elected by good people who don't vote.
We're going to put that on our Facebook. So we're talking to the girls here. We're going to put that on our Facebook. That is true.
I was telling my husband yesterday, I said, some of these politicians, they need to invest in some asbestos-proof, you know, underwear, because I'm sorry, where they're going, it's going to be a little bit hot. So I mean,
I hope they can take it with them. Yes. All right. So let's end. This has just been such a interesting, engaging. You two are too much. I mean, I can't.
That's two or better than one.
So the piece, though, to end on is thinking of, okay, we got a lot of urban folks watching this. We have West Coast folks watching this. And you've talked about need and advocacy and saying we need more. But what would be your message to each of you? These do sort of complete each other's sentences, so maybe we could, however you want to do this. But what's your message to folks watching? What do we need? We who don't do your work, we who come from a different place, what do we need to be aware of, and how could we support you in your work?
That this is the United States of America, and we serve one of the most vulnerable populations in the U.S. that people don't even know exist. I mean, you know, when we have events and people line up a week in advance to get a tooth pulled or to get eyeglasses or something like that, this goes on in America. We need the help. I mean, go to the healthwagon.org, our website. You know, contact us. You know, if you've got a resource out there for us, we're always looking for resources.
We need prayers. We need volunteers. We need,
yes,
we need prayers. We need volunteers. We need money to help keep doing this. And we need to spread the word to politicians to keep this going. Yeah. We need to say, stop fighting and do the right thing.
Do the right thing.
Stop fighting like children and do the right thing. Yes. You know, you've got good health insurance, give it to everyone else.
Yes, amen, sister.
Or at least give them a free clinic like ours. You know, do something.
Do something that extends service to people, not undercut it. I hear you. I hear you. Well, okay. What can I say? Dr. Teresa Tyson, Dr. Paula Hill Collins, you two are amazing. And I love your energy. I love your commitment. Your expression of faith touches my heart deeply, and I am so grateful that the people on Nuns on the Bus, all of the folks watching, get a chance to meet you. So thank you so much for this amazing conversation, and I promise, after COVID, we'll be back on the bus and visit you personally.
Please, that's our dream. You're our hero too.
Thank you. We'll bring those buses together.
I love it. I love it. We
maybe park them in Richmond at the state, and maybe park them in DC or somewhere right there together. We actually were told to do that at one time to bring our van, but because of all the 9/11 changes, we couldn't get our van there.
All right, but we'll get together.
We'll get together.
Okay, thank
you.
Thank you for giving our people a voice. We really appreciate it.
It's an honor. It's an honor. Thank you. Bye, y'all.
Bye-bye.